is Christy Repair, and this is my head-to-toe assessment. Okay, prior to the patient's exam, I checked her vital signs, and her blood pressure was 122/68. Her pulse was 74, respirations 18, temperature 98.2. Her weight is 140 pounds, and height is 5'2", making her BMI 25. I assessed her visual acuity using a Snellen chart, and in the right eye it was 20/20 as well as in the left eye. Okay. Good morning. My name is Christy. I'm going to be the nurse practitioner student doing your head-to-toe assessment. I'm going to start by asking you a few questions. Can you tell me your name? Tabitha. What is your date of birth?
5/21/83.
And what year is it?
2018.
Can you tell me where you are?
I am in the medical facility.
Okay, great. The patient is alert and oriented ×3. She appears well dressed with a good affect, well groomed. Her skin is intact from what I can see. Her skin is also warm and dry. I'm just gonna start from the top and work my way down. First, I'm gonna palpate your head. Let me know if you feel any pain or tenderness, okay? Anything? Okay, great. Her hair is evenly distributed. There's no lesions or abnormalities. Her scalp is normocephalic. Going to now assess your temporal pulses. Great, they are 2+ bilaterally. Going to go down and assess your temporomandibular joint. Open your mouth, close, clench your teeth. Great. Her muscle is strong on both sides. Go ahead and open your mouth again and resist me trying to close it. Great. Okay. Now I'm going to assess the sensory function of cranial nerve 5. What I want you to do is tell me if you feel the object I place on your head, if you feel it equally on both sides. Equal? 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 Okay, great. Now I'm going to look in at your eyes. First, we're going to assess 6 cardinal fields of gaze, okay? I'm going to use this pen, and what I want you to do is just look at the pen with your eyes and follow the pen with your eyes only and not your head, okay? Okay, great. Her gazes are intact. There's no nystagmus present. Now what I'm going to want you to do is just keep your eyes right here and follow the pen as it moves closer to you, okay? Perfect. Her eyes converge bilaterally and her pupils equally constrict as the object moves closer. Okay. Now I'm going to look at your sclera. Your sclera is white. Your conjunctiva, look up for me. Great, it's pink and moist. There's no drainage present. I'm gonna I'm gonna test your pupillary response in both of your eyes. Just look straight ahead at me. Great. Okay, in both of our eyes, the direct pupillary response is intact, and the opposite eye has a consensual response. Now I'm going to look inside of your eye and assess the internal structures. Just look ahead at me. Okay, great. I see her macula, fundus, her optic disc, and the internal optic vessels in the left eye. And in the right eye, I see her optic disc, her fundus, fundus, her macula, and also the internal optic blood vessels. Okay, I'm gonna move to your mouth. Cranial nerve 7, I'm going to assess that next. What I'd like you to do is raise your eyebrows, puff out your cheeks like this, smile, frown, show me all your teeth, stick out your tongue, wiggle it side to side. Perfect. Okay. Now I'm going to have you open your mouth. Say ah. Okay, lovely. Okay, so Tabitha's external mouth is without lesions. Her mucosa on the inside is pink and moist. Her posterior pharynx is without erythema or exudate. Your teeth are all intact. Your soft and hard palate was also intact, and the soft palate rises, and her uvula stays midline when she says ah. Okay, now I'm going to look in your ears, okay? I'm gonna start on the right side, and what I'll be looking for is her tympanic membrane. Assessing the color, it should be pearly and gray. I'll be looking for the internal structures, the incus, the malleus, and the stapes. And when I shine my light into her ear, I should see the cone of light at the 4 to 5 o'clock range. And when I assess the left, I should see it in the 7 to 8 o'clock range. Starting on the right. Yes, your tympanic membrane looks perfect, and I see all of those structures and the light in the appropriate spot. On the left side, your tympanic membrane is intact and looks appropriate. Your structures are visible, and the cone of light is in the 7 to 8 o'clock range. So while I have this, I'm going to just go ahead and look in your neck and your nares. Okay, her turbinates are patent, and her mucosa looks good. I'm going to assess cranial nerve 1, the olfactory nerve, and have you smell this and let me know what you think it smells like. Close your eyes. What does that smell like?
Coca-Cola or Pepsi or something.
Perfect. Okay, now I'm going to assess your hearing. So first I'm going to start with cranial nerve 8, and just whisper something in your ear and let me know if you can hear it.
Yeah.
Okay, now I'm going to do the Weber test, and what I'll be looking for with the Weber test is sensory neural hearing loss, and what you should feel is you should hear the vibrations equally on both sides, okay?
I hear them on both sides.
Perfect. Now I'm going to do the Rennie test, and this is going to test for air conduction and bone conduction. The air conduction should be longer, so I'm going to put it on your bone first, and when you stop hearing it, let me know, and then I'll move it to another position, and you let me know if you still hear it there, okay?
Okay. Yep, I still hear.
Perfect. Now the other side.
Okay. Still here.
Great. Okay. Excuse me. Now I'm going to palpate your lymph nodes, and what I'll be looking for there is symmetry, and they should be non-tender, and they should not be hard or fixed, okay? So I'm going to start with your pre-auricular lymph nodes, move to your post-auricular lymph nodes. Just let me know if you feel any tenderness anytime I touch. Your tonsillar nodes, your submandibular nodes, your submental your superficial cervical, posterior cervical, occipital, your supraclavicular, and infraclavicular. Any issue there? Perfect. We're gonna move to the carotids, and I'm just gonna palpate on both sides and then listen, okay? 2+ on her right, and 2+ on her left. That's great. Now I'm gonna listen with the bell of my stethoscope to see if I hear a broogie. Great. No broogie. Okay, now I'm going to move on to your thyroid. I'm going to palpate your thyroid, assessing for any like masses or nodules or tenderness. So let me know if you feel any tenderness when I ask you to do the things. I'm going to do it off to the side and behind the patient. Palpating. I feel no masses or nodules. Can you go ahead and look to the right and down? Swallow. Great. And left and down. Swallow. Great. No issues there. Any tenderness? Great. So now let's do some range of motion. I'm going to palpate your clavicular area and make sure there's symmetry. Great. Feels symmetrical. I'm going to push down here and raise your shoulders up against me. Strength is great. Okay. Now I'm going to look at your lymph nodes on your arms. Okay. I'm going to be looking for the same thing that I looked for up here in your lymph nodes. Hard, fixed, tender. Let me know if you feel any of that, okay? I'm going to do your axillary lymph node, central, lateral, scapular, pectoral, and epitropular. Any tenderness? Okay. Same on this side. Axillary, central, lateral, scapular, and pectoral. Any issue? Okay. Range of motion of your arms. Go ahead and stick them straight out. Raise them up. Move them back behind you. Great. Adduct them in front and abduct out. Put your elbows, range of motion like that, and up. Perfect. That was easy for you. No pain or issue. Perfect. Now I'm going to palpate your radial and brachial pulses and make sure they're equal bilaterally. The right radial is great. Left radial is great. Both 2+. Brachial. 2+ as well. And 2+ as well on that side. Now I'm just going to test your strength. I just want to say text. Squeeze my hands. Great, that is even bilaterally. And one thing I forgot to check earlier that I want to do is a confrontation test with your eyes. So what I'll be doing is making sure we are at the same level, and I'm going to check your peripheral vision and visual fields, okay? So I'm going to have you cover your left eye. Left eye. And I'll do the same thing so that I know that our visual fields in the cone is the same. And I'm just going to hold up some fingers in different fields, and you tell me or how many fingers that you see, okay? Let's start down here.
1, 2, 2, 1.
Great, now we're going to do the other eye. next I'm just going to visually look at my patient's general ease of breathing. She shouldn't be working too hard. I should not see her using any accessory muscles of the neck or belly, which she is not. She is breathing well. Do you feel short of breath? Great. So then I'm going to auscultate your heart sounds in all the areas. I'm going to be looking or listening for heart murmurs. So just listening in the aortic area, pulmonic, tricuspid, mitral, and then the point of maximal impulse is the fifth intercostal space at the midclavicular line. I did not hear any murmurs. S1 and S2, perfect. Now I'm just going to move to the back. If you could kind of shift a little bit here. Perfect, thank you. So what I'm going to do next is called assessing your tactile fremitus. And with that I'll be using the ulnar portion of my hand. Just kind of feeling for the vibrations when she says the word 99. And this will tell me if I suspect any like consolidations, possible pneumonia, things like that. So when you feel my hand on your back, just say the words 99, okay?
99, 99, 99, 99.
Perfect. Now I will be listening for the same words for bronchophony. I'm going to listen to how the word 99 sounds. If it sounds more clear, then that would tell me that there's possible consolidation in that area. So when you feel my stethoscope, Tabitha, just say the words 99 again, okay? Go ahead.
99, 99, 99, 99.
Amazing. Okay, now I'll be listening for egophony. I'm going to have her say a vowel E. I'll be looking for it not to distort and sound like an ah. That would be a positive finding of possible consolidation as well. So when you feel my stethoscope on your back, go ahead and just say E, okay? Go ahead.
E.
Okay, beautiful. I heard E throughout. I did not hear it distort to ah. Okay. Now I'm going to move to percussion. So I'm just basically going to tap your thoracic cavity and be assessing that way for any signs of consolidation. Perfect. Now I'm going to move to percussing for CVA tenderness. So when you feel me tap, I'll be placing my hand on your back and using my fist to percuss in that way. And if you feel tenderness, let me know, because this is used to assess for kidney stones or possible like pyelonephritis or infection of that nature, okay?
Mm-hmm.
So here we go. Any tenderness there?
Nope.
Perfect. Now I'm going to go ahead and have you lay back and we'll move on to the abdomen. So what I will be doing first is listening to your abdomen. I'm going to assess for bowel sounds in all four quadrants, make sure that I hear them in all of those spots, and then I will be assessing for vesicular sounds, the iliac, renal, abdominal arteries, and then I'm not going to listen because she has pants on, but I could listen to her femoral arteries. First, a general inspection. I don't see any visible pulsations, no hernias, major scars, or anything like that. So we'll move on to auscultation of your bowel sounds, listening in all four quadrants. Great, I do hear bowel sounds in all four quadrants. Now, with the bell of the stethoscope, I will be listening to the on to percussion. So I'm going to percuss my way around the abdomen, noting the liver will be in the right upper quadrant and the spleen in the left upper quadrant. And I should hear dullness over those areas. I'll assess the edges to kind of determine the size of the liver and the kidney, or of the spleen. And if I hear that dullness in any other area, that would be a warning sign that there could be a possible mass in that area. So moving on to percussion. The liver in the right upper quadrant, spleen in the left. And no other areas of dullness. I'm going to move on to palpation. First, I'm going to palpate her abdominal aorta, make sure it's of the appropriate size. It should be less than 3 centimeters in diameter. Perfect. Now I'm just going to do a light palpation and assess generally the same things I was assessing for with percussion. Like I said, the liver and spleen, assessing the edges and size, and making sure I don't feel any masses anywhere else. I'm going to go lightly first, and then a little bit deeper. Do you feel any tenderness with any of this? Perfect. Now, could also percuss and palpate for abdominal bladder distension as well. Okay, now I'm going to move on and palpate in the right lower quadrant, specifically looking for rebound tenderness. I'm going to push in that area, then let go. And if you feel pain in that area when I let go, let me know, okay? Any pain? No? Okay, if she did feel pain there, I would be concerned for appendicitis. 2 other assessments I can do for appendicitis and peritoneal inflammation in general is the psoas sign. We'll do that. I'm going to have you lift your right leg up, and then I'm going to apply pressure. Do you feel any pain when I do that? No. Okay. The next will be the obturator sign. I'm going to have you lift your knee to a 45-degree angle, and then kind of inwardly shift it. Okay. Any pain there in your belly? Okay. Awesome. Now, moving on down, we're going to, first I'm going to look at the hips, kind of palpate your hips. Do you feel any tenderness? Okay. There's no swelling in her hips. Just moving my way all the way down your legs. Let me know if you feel any pain. Assessing the knees. Any swelling? I do not see any swelling. No tenderness. Then down to the ankles, same thing, no tenderness. Okay, I'm going to go back and feel for the popliteal pulse. 2+ bilaterally. The dorsalis pedis pulse. 2+ bilaterally. And the pedal pulse. 2+ bilaterally. We're going to do a little bit of range of motion. Just go ahead with the right leg, pull that knee up towards your chest. Any pain there? Easy. Left. Easy peasy. Great. Now just raise your right leg up, down. Same with the left, up, down. We're going to do abduction and adduction. So out and in. Same with the left, out and in. And then just plantar flexion, extension. Beautiful. Any pain with any of that? Awesome. Now we're going to move on to the reflexes. What I'm assessing for here is a hyperreflexia state, okay? So I'm going to check several different reflex points on you. First, I'm going to start with the bicep, move to the tricep, brachioradialis, patellar, and then Achilles, okay? We're going to go on each side, so we'll start with the side. Okay, bicep. Good. Tricep. Good. Brachioradialis. Good. Move to this arm. Bicep. Tricep. Good. Brachioradialis. No hyperreflexia noted in any of those reflexes. Now I'm gonna have you close your eyes. I'm gonna put something in your hands. We're gonna test stereognosis and see if you can kind of tell me what the object is. Name the object that I put in your hand, okay? Close your eyes. Okay? What does that feel like to you?
Feels like a pen.
Perfect. Thank you. Okay, now we're going to stand up and do a lot of range of motion stuff, okay? First I'm going to assess your gait and see like your ease of walking and stuff. So first what we're going to do is like a heel to toe. If you could just walk towards that wall and then on your way back, walk normally. Good. She has good balance, ease of walking, no swaying. Okay, now I'm going to have you kind of bend from the hips forward and like towards touching your toes. I'm going to look at your spine. Perfect. What I'm looking for here is like any curvatures or signs of scoliosis. I don't see any, so you can stand back up. Perfect. We're going to do like lateral bending. First to your right, then like that. Then to your left. Perfect. I'm going to stabilize your hips in the front, and what I want you to do is lean backwards. We're just looking for range of motion. Good. Is that difficult for you?
No.
Okay, the range of motion is really good. Now, the last one is we're going to like sway side to side, so like a washing machine movement there. Perfect. Okay. All her range of motion is good. Things are easy for her. There's no pain or difficulty with anything like that. The last thing we're going to do is a Romberg's test. What I'm going to do is have you close your eyes, pull your arms out with the palms up, and I'm just kind of going to assess you, see if you sway around, if you stay in one spot, and see if your palms drift or if they stay in place. Okay, so go ahead and close your eyes and put your arms like that. The patient is not swaying. Her palms are not drifting. Her arms are staying where they are placed. Okay, Tabitha, you're done? Okay, we're all done. Again, I'm Christy Repair, and this was my physical assessment. Thank you.